I'm a physical therapist. I've been a physical therapist for over 30 years, and I'm truly blessed to be able to serve my community and my patients to help people every day. And, you know, as a physical therapist, we help people move better. We are movement specialists, and we help get people out of pain. Now, at Back to Normal, we do things just a little bit differently. So I wanted to just share some of those things with you. So firstly, our vision is whole body healing to get you back to normal. So what do I mean by whole body healing? Well, first and foremost, what we really try to do when patients first come in is to listen. I always say the mystery is in the history. So if you ask the right questions, patients will usually tell you what you need to know. So one is just taking the time to listen, hear people tell their stories, and try to make the different connections that might be going on in their life and in their body that are impacting their ability to heal and to get out of pain. So that's first and foremost. Secondly, we go beyond the injury site, right? So most of the time when we go in and we see a practitioner, so for example, if I had a shoulder problem and I went in to go see a doctor, typically they're only going to look at the shoulder. And you may have experienced this if you called to make an appointment and you had multiple things. They told you had to make a separate appointment for each body part that you had. Well, at Back to Normal, we believe everything is interconnected. So if you're coming in for your shoulder, we are still going to look at how your entire body moves. We might be working on balance and working on your foot mechanics and how maybe your glute muscle is firing and how that ties into your shoulder. So we're going to look at the whole body, the kinetic chain, meaning how that whole entire arm or whole leg works into getting people out of pain and getting people better. Then the next thing that we do is go beyond just maybe, well, first it is also the body, but also going beyond and looking at other circumstances. So for example, if somebody has an extreme amount of stress in their life, then that's going to impact their pain. When people are very stressed, their nervous system is very heightened, and it's very hard to get people out of pain. And also if people, for example, aren't sleeping. If people aren't sleeping, then their body's not fully recovering. And if they're not fully recovering, it's going to be hard to help somebody heal. So looking at all these different aspects, perhaps they sit at a computer all day, how they sit at the computer, how the ergonomics are set up, that is going to impact the stress on their body. So we need to look beyond the injury, look at the whole body. And then the other piece might be, for example, looking at their nutrition. What kind of supplements maybe they're taking that could be helping with healing and reducing inflammation. Or perhaps they have issues with their gut. Issues with their gut make it very difficult for the whole body to heal. And as a matter of fact, if somebody came in with low back pain and they had a lot of inflammation in the gut, it's very hard to strengthen the core. So we have to look at the whole picture. So then what we do is we use various technologies, both for an assessment. So for an example, every new patient that comes in gets a heart rate variability test. Heart rate variability gives us a great indication of how your nervous system is functioning. And if you're not managing stress well, again, it may be difficult for us to do certain things with you in therapy because the nervous system might not adapt as quickly. And then it also makes it harder to get you out of pain. So we want to do an assessment using that technology. And then we have another technology called Newbie that helps to decrease the threat of that pain that your brain is constantly perceiving, to decrease that threat to the system, get your muscles talking with the nervous system to get you moving better and to get you out of pain. So we have various different technologies, different products that we use that you can take home so you can continue your self-healing and giving you good home programs that's going to complement what we're doing. So we really try to use these things to help speed and heal your recovery. And lastly, we work as a team. So whether you're coming to Back to Normal and we have services and specialties that can serve you and help you get to where you need to be, then we're going to work as a team. So say, for example, you come in and you have a lot of balance issues, but you also have shoulder pain. Well, we have a vestibular specialist, so they can take a look at some of the balance issues and work on that while we're working on your shoulder. Say, for example, there are some things with the gut. We have a functional nutritional therapist, and she may work in conjunction with our visceral manipulation therapist, who looks at the organs and how the organs are moving and can be impacting your pain. We have Pilates specialists, of course, and if you need a little help with accountability, we also have an accountability coach that can help you. So we have a great internal team that, listens to you, figures out what the problem is, and then figures out who is going to be the best person or several people for you to work with to optimize your healing and your recovery. And then, of course, we have many partners and various practitioners that treat the same way that we do, but maybe that we don't offer at Back to Normal, and we will pull them in when it's appropriate if we need further assistance with your healing. And hopefully that gives you a little window into Back to Normal physical therapy and how we do things just a little different. All right, you guys have a great day.